Good afternoon and welcome to Webinar Wednesday. We're excited to have over 300 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday t-shirt for answering this trivia question. April is National Pecan Month. Which state produces the most pecans? Answer now using the questions feature on your dashboard. While you're answering, I just want to remind everyone that if you've missed any of our previous webinars, you can watch them on our website, webinarwednesday.live, and you can still receive a CE credit as well. Okay, let's see who the winner of our Webinar Wednesday t-shirt is, and it is Kelvin Knight. Congratulations, Kelvin. The correct answer is, of course, Georgia. Webinar Wednesday would like to thank our sponsor, Nuvolo. Nuvolo helps companies better manage enterprise assets using modern, mobile, real-time reporting and an industry-leading cloud-based platform. Visit nuvolo.com for more information. Our presenters today are Holetz and Dustin Smith, both Senior Solution Consultants at Nuvolo, and Russell Rice, VP of Product Strategy at Ordr. Russell, you may begin whenever you're ready.
Hello, everybody. Thank you very much for joining our webinar. Kyle, Dustin, and I are very excited to present to you today. We're going to focus on what our technologies together can provide and our organizations will offer for you in the health services organizations. The title of the webinar is your CMMS Cybersecurity Ready. Is really the focus for what we're going to be talking about. And as was mentioned, my name is Russell Rice. I'm head of product strategy at Ordr. And I'll be introducing our product and our company and kind of why this is relevant to you in a few minutes. I've been on the practitioner side in cybersecurity for about 25 years, for a long time, and kind of specializing in this space for a long time as well. So, Dustin, Kyle?
I'm Dustin Smith. I have been with Nuvolo for a little while now. I started with them this year. Prior to that, I was with Intermountain Healthcare for over 13 years. And a large portion of that was in operations and analytics. And I really cut my teeth with HTM there and finished my career in HTM at Intermountain.
Great. And hey, everybody, this is Kyle Holetz. Background on myself is longtime ServiceNow platform architect and application developer, as well as, had the opportunity to be a part of a founding team for another CMMS company that was purchased through acquisition, and spent now about 2 years with Nuvolo leading our healthcare technical sales team here. So looking forward to taking everyone through the demonstration.
So today we're going to cover a pretty broad area. I'm going to spend some time and introduce you to Ordr and what it means for our solution to help you protect from a cyber perspective your whole hospital. In terms of gathering control of your inventory from a medical device and whole hospital's perspective, and then give you a demonstration of how our technology actually helps you do this. Then we're going to focus and talk about Nuvolo's technology in terms of how it's going to be able to help you achieve medical device cybersecurity and give you some good examples of how this technology actually works, and we're going to give you a demonstration of that too. We're going to follow it up with Q&A as part of this session, so hopefully you'll find this a jam-packed activity. First, Ordr. Our organizational focus is providing healthcare organizations a comprehensive closed-loop solution. And given where we are today in industry and kind of in the world, I will say, you guys are on the front lines right now as are your organizations for dealing with COVID-19. On a personal basis, I and my family and all my extended friends, very much appreciate all the efforts that you and your compatriots are doing in this regard. It's not business as usual. And I know that a lot of organizations are really accelerating and scaling their use of care delivery to help deal with patients right now on the growing numbers that we've got. And that's, it's putting challenges across the entire spectrum of healthcare organizations. I will share with you that the amount of equipment and kind of care delivery that organizations are having to do is doubling from some of the organizations we're working with, has doubled in the last couple of months, which is phenomenal. And I will also say it's presenting some challenges as we try to turn to normalcy here. And so part of what we're talking about may help you in this regard. One thing that I will call out, about 6 months ago, I was with an organization that had suggested that they wanted to be in a position to be able to deal with both a pandemic as well as a huge cyber attack at the same time. And unfortunately, at least one of those was presciently occurring at this point in time, and that's kind of the challenge. It's all of us in the back of our minds, how to make sure that even in these times of crisis, we're not put at more risk from cybersecurity threats, and that's part of what we're going to be talking about today. From an Ordr perspective, we tend to find that there's 5 things that organizations tend to talk about that they want to achieve when they think about comprehensive control. The first is getting a real good understanding of all the connected systems in the environment. This spans not just medical equipment, although that's clearly the most important category for healthcare organizations, but all of the other systems that you've got that are connected that are in the environment. Having a good understanding of exactly what they're doing when they're connected, who's talking to them, where they're talking, is it right, is it wrong? Understanding which systems may be vulnerable, whether they're running old patches, old versions of software and have known vulnerabilities or FDA recalls, or there's actually observed configuration issues with the devices. And then when it becomes important, how to actually implement protections that are right-sized to exactly what equipment you want to protect because of its criticality, urgency, or importance to the organizations, or because it's highly vulnerable. And then lastly, there are many who are very interested in getting a good handle around utilization of equipment. This is less a cybersecurity issue, but understanding, am I actually using all of my infusion pumps, or do I have a lot of squirreled away in closets that just aren't being used? And do I really need to buy 30 more? Or am I at a point in time when I can don't have to renew the leases on some of the equipment I'm using? These 5 questions, we tend to find that people are not really satisfied with the answers that they have today, and that's where we step in as an organization trying to answer and address all of these pieces. The technology that I'll introduce you to really focuses on not just the medical equipment, but protecting the whole hospital. The majority of the organizations that we work with, while medical device security and inventorying was really the first purpose that they were looking for using our technology to improve their processes, the other sets of equipment that they have in the hospital, whether it's facilities equipment, whether it's elevator controls, whether it's sensors, security cameras, all of those were also part of in scope, and I'd say about 80 to 90% of all the organizations we've dealt with have looked for whole hospital solutions, not just on the medical side. Because at the end of the day, as was professed in an advisory panel that we'd set up about a year and a half ago, when the panelists were actually asked, and they were all health service professionals, kind of what's your weakest link? Half of them were actually saying it's an elevator control or heating control systems, which are just very different than the medical devices, because they realize the implications that those systems could have from a cyber risk perspective for the healthcare organizations. But that said, really getting a good handle on the medical equipment is really important. And so, our solution and solutions in general must be able to provide and cover everything you got. We happen to be fortunate that, having been in industry now and selling our product actively for about a year and a half, we've been able to get a very amazing loyal customer base. We've worked very hard and worked as great peer partners with organizations like Mayo Clinic and Cleveland Clinic and a variety of others that you see on this board. And we'll continue to do so. Nuvolo and ourselves, Ordr, both have several of our organizations in common here, and so hopefully you'll be able to recognize that what we're doing, you wouldn't be by a long shot be one of the first ones to leverage some of the new technology approaches that are available to you here, and some notable guys on the board are doing it right now. Our solution, which I'm about to get into a demonstration mode for you, really focuses in these 6 areas that I'll call out. First is being able to automate the ability to passively identify all the devices that you've got and get behind what it actually, what it is over the wire to what actually it is, kind of the make, model, serial number level details, and do that continuously. And being able to analyze exactly what that system is doing in your environment, what it's talking to. Is it doing things that we would expect? Is it doing things that we wouldn't? Can we track the utilization of that device when it's actually delivering care, and we can let you understand which devices may not be heavily used, so you can consider CapEx and OpEx sides. We track vulnerabilities from a variety of different sources, whether this is the FDA or certificate services where manufacturers publish information about known vulnerabilities of those assets. But we also on the ground provide constant 24/7 threat detection, where we're looking for active attacks, we're looking for indications of compromise, we're looking for any exposed vulnerabilities that weren't expected. And that allows us to risk score every asset and group of assets together. So we'll give you a risk score for every infusion pump, we'll give you risk scores for every imaging device. And we'll be able to do this on an agentless perspective, and we'll extend beyond the direct medical equipment, but also deal with workstations that may be fronting medical devices, which we call medical workstations, or iPads or phones that happen to be doing a lot of medical activities on them too. So you'll get all of that intelligence and be able to waypoint and share that information with the security operations too. We as an organization focus very heavily on being able to provide a protection model around equipment as well. We know that for many organizations, you don't have the opportunity to control all of the equipment that you may be using, and in often cases you are using equipment that has known cyber vulnerabilities to it that there's not necessarily patches for. And care delivery still wins, and serviceability and operational uptime for those systems has to win over everything else. But how can you start implementing safeguards around those equipment in an effective way that allows you to be very specific around protecting those assets without disrupting them nor disrupting the rest of the environment? So as an organization, we focused a technology that can provide you the ability to get device-centric or very specific segmentation controls. So for example, if you have a set of Windows 7 systems that you know are vulnerable, you can't take out of operation, you're still using for the next 6 months or 12 months, how do you start implementing controls around them to control who can reach them and minimize the cybersecurity threat? We happen to excel in that area of our technology, and I'll give a teaser on that when I do the demo. But let me flip away from the slides now and just flip over to a demonstration so you get a feeling for this technology. So I hope that you guys can now see what I'm trying to share, which is a front end of our user interface. And right now I've homed in on one of our inventory pages where you're seeing in this environment, in our sample demo environment, we found about 6,000 devices in the environment. And as I kind of scroll down here, this type of information that I'm showing about, how we've categorized every single asset. There's a lot of medical devices, about 1,000 of them. We've got facilities, equipment, media devices, phones, printers, copiers. This type of stuff is all passively obtained, where we've learned the category of all the devices in the environment automatically. Our technology goes in and kind of interacts at the network layer to learn what systems that are there. We do what we call deep packet inspection to figure out what these devices actually claim they are over the wire, and it's completely non-disruptive. In fact, you'll get this level of information, and as I start drilling into the devices, you're going to get this, within the first day of when we deploy, which is just amazing. As I scroll down, we get deeper into what manufacturer levels you're dealing with in terms of different equipment. And here I've kind of sorted based on the commonality or frequency of these devices, but so you're seeing GE equipment, Philips equipment, and over here you're seeing summaries of OS types, kind of how many XP and Windows 7 devices. I think in terms of proof of concepts that we've been in, we have not yet run into an environment which did not have a lot of old antiquated operating systems that were embedded and being used in the environment. And in many cases, the organization didn't even realize that. Our solution does risk score devices, and over here you're seeing some summary stats in terms of how many devices we found at critical levels of risk. I'll get into that in a little bit later in the demonstration. But what I wanted to first zoom in is talk about the inventory side, because that's usually ground zero. Organizations wanting to get a good handle of exactly all the equipment they've got and reconciling what we see in the environment and what may be actually in your CMMS tool like Nuvolo. And so we provide automation in terms of being able to, number one, identify all the assets. So here you're now seeing a pictorial view of different collections of devices that we found in the environment. And what we can do is we can take this information and get very deep on what those assets are. So for example, if I want to turn around and look at all my GE devices, I can quickly zoom in and see all the GE equipment that we've discovered in the environment. Most of this is obviously big iron, but if I want to drill into the 14 imaging boxes that I've got here, I can show you a list of them, and then I can drill in and actually show you specific boxes. And here's a specific imaging device that we've got. And you're getting down to automatically figuring out the model number, the serial number, the software load level. This type of information we're gleaning for the vast majority of all of your medical equipment. And then again, we're doing passively. Not only do we learn what these systems are, but we also learn where they're connected in the environment. This is the type of stuff that the IP and the networking team care a lot about. Kind of, is it connected right now? What IP address? What MAC address does it have? What VLAN and subnet is it in? That helps us understand if you've been trying to segment different sets of equipment and keep certain departmental equipment isolated in its own medical network or departmental network. Is that actually happening? We automatically group devices by their type, and here you're seeing us group medical devices. This GE box, in terms of it's a very specific 9900 DSP medical imaging device, and we've categorized it automatically for you as a medical device. We're risk tracking in terms of scoring any security issues that we've got with the device in terms of known vulnerabilities or active attacks that are going against it or indications of compromise. So all of that information we're collecting. And the real good news and kind of where our solution and Nuvolo intersect is we become the eyes and the ears of the network to understand what equipment we're actually seeing in the network. And then through our API integration with Nuvolo, we can reconcile all of the inventory information that tool has in terms of making sure then that every single system that we see is onboarded and brought into compliance, and that the information about that asset is accurate. Right now, many times when you use a CMMS tool and use a Nuvolo, there may be some manual entries from some of the fields where you're trying to track some of this information by hand. And in these cases, will always be accurate information in terms of software load levels and MAC address and is it actually on and stuff like that. So you'd always be apprised of what's going on in that regard. And so that integration automatically happens for you. And so your ability to actually reconcile what's on the ground versus what's in your CMMS tool becomes I won't say effortless, but becomes much more automated from a procedural standpoint, which is a huge leg up. Going a bit further, interestingly enough, in the integration too, we're actually able to learn information from Nuvolo that we don't necessarily able to learn ourselves. And if I click here on this asset list, for example, I can show you the type of information that we can learn from Nuvolo. And that would include, for example, who's the business function that owns the device? What's the department that's responsible for it? Is there a technician who's responsible for the actual system, and who is that? This type of information we can also glean, which becomes very useful because then you get both the people who are using the health services side of the equipment and the people who are using our tool, whether it's IT, security, or yourselves. All of you have a common view of what this asset is, who owns it, where is it in use now, is it at risk? And that synchronization of the information between the systems becomes pivotal in making that possible. So that's one of the big steps that we've got for inventory. And this high resolution information, again, is going to be available for all your medical equipment. In fact, if I pop back up here and instead of looking at GE equipment, I've been talking about medical equipment. I'll just quickly show you. We have the same thing for things like cameras, where I can show you all the cameras and we can go deep in any single camera, and I'll get deep in what's there. And so this type of knowledge for all of the whole hospital view is what you're starting to glean out, complete information with pictures about every asset you've got. But let me flow back to the medical device equipment right now, and let's just look at pumps. They tend to be the most common set of equipment that everybody's got in their environment, whether it's Alaris infusion pumps or Hosperas and the like. I'll drill in some of the Hospera pumps, and I'll show you another thing that we're tracking for you, which is not only what it is, and here's a Hospera pump that's in use, but we also are able to track where it's communicating. And so in this case, what I'm showing you now is what we call the flow genome, which is allowing us to understand all the communications to and from this Hospera pump. In fact, every system that it talks to tends to be another trapezoid representation here, where you can see the flows of where it's talking, and you can see the specific application conversations. Now, some people on the more technical IT side and health services really value this insight because it provides you insight in exactly, are these systems communicating where you expect them to be? And we'll point out any time that we see systems that are communicating in odd ways to systems that they shouldn't, or potentially under attack. And this type of information in terms of who it's talking to also allows people who are implementing segmentation services to actually have a data-driven approach to making that happen and making sure that it's all accurate. And our tool provides a lot of accelerants to make it very easy to protect your pumps, for example, if you had a known vulnerability, so that you could isolate them and keep them operational, but make sure that they're not interfered with by any contaminated workstation or something else that even may be in the same part of the networked environment where the pump is actually operating. And that's one of the unique things our system allows you to do. I won't go through that part of the demo because it gets a little bit more complicated, but I just wanted to share with you that our system provides that insight as well. Two other areas that I was going to dive into pretty quickly, and then I'll flip the baton over, is we also provide a summarization of security risk. So now I've gone to a security dashboard that our tool up levels for you. And all of the security intelligence that I'm about to show you here is also something that we share with Nuvolo. So all of the security intelligence that we learn in terms of over-the-wire active threats or misconfigurations or running of old software, we will share all those as security incidents and information over to a Nuvolo system. So you have that at your disposal if you're just using the Nuvolo tool as your front end to manage all of your medical equipment, which is what many and most people we find want to go do. But we're tracking a variety of different types of vulnerabilities. So we'll have an understanding of FDA recalls, for example. So anytime that the FDA issues a recall, we'll match that up with any connected inventory that we found automatically for you and allow you to therefore understand and associate those together. So here you're seeing that we've got quite a few different recall systems and announcements right now, whether they're ultrasounds or the like. And you can quickly zoom in and look at all the recall notice information, find out the actual recall info. But we're also tracking other types of vulnerabilities. So if I turn around and want to look at systems from do I have any active systems that are reaching out to known bad URLs? And this does happen. We've had several pieces of medical equipment being contaminated and actually reaching out to known malware sites or phishing sites. We've had instances where systems, workstations that were fronting medical equipment were reaching out. We're doing crypto mining and actually slowed down the image transfer that was occurring for some of the imaging boxes that they're fronting. All of these things, you start getting some intelligence around. So if your service and cybersecurity intelligence becomes much more pronounced now. So here we're summarizing a lot of the security issues that we've seen in a dashboard view. But down here, what I'm also showing is the real value of we attach all security issues to the specific devices involved, and that allows us to risk score your devices. And again, this is all passive. So I'm now able to understand without interfering with your operations that your organization has 16 devices at critical risk. And as you see this list right now, you're going to see several of these devices fall within different types of systems. I'll sort them just to make it a little bit easier, but you see that there's definitely some medical devices down here that actually have some security issues with them as well as several workstations and some facilities equipment. But if I want to drill in, I can go into the specific device in question that has security issues. I can go deeply into the security incidents and find out what the issues are. In this case, this has an SMB attack that's going on. And all of this information, again, will flow over to Nuvolo, but you're getting a one-stop shop for what the device is, which is this tab. You're getting a good view of, do I have any risk issues with this device, and a summary of that, and you're getting complete information of where it's talking. So all that set of data is kind of fundamentally available to you. The last piece that I'll introduce to you, and then I'll hand the baton over, is a brief mention about some of the utilization that we track as well. One of the things that organizations have been very keen to do is be much more data-driven about device utilization tracking. And by that, I mean, not only is a device connected, but how often is the device actually delivering care in a given time period, whether it's a daily view or a weekly view or a monthly view. And so our system tracks that as well. We do it for two classes of equipment. One, we do it for equipment that's more on the imaging side that tends to use a protocol called DICOM, where it's sending that information. And this is where your ultrasounds, your x-rays, your MRIs will do it. So we're tracking those uses, but we also do it for what I call fleet equipment, kind of the things that you have in scale that often follow the patient. So things like pumps. And so, we've tracked the use of all the pumps that this organization has. And here's a bit of a daily view where we're showing you utilization of all those pumps when they're actually delivering care. And so as you can see in this regard, in this day, we've got 86 of our devices of our fleet of 112 are not actually were not even used to deliver care. And these type of stochastics become really critical when one tries to make sure that you're cost effective and do you have the right amount of equipment based on utilization schedules that you expect, so that are you either under capacity or over capacity, and that can help you make some very educated decisions on the supply chain perspective. So that's a bit of a tour de force on this tool. What I'll do right now is hand over the baton to Kyle and to Dustin so that they can talk a bit about Nuvolo and that part of the leg. So thank you, guys.
Thanks, Russell. So one of the first things that you're going to ask as a healthcare organization is, what's in my inventory? And it's changed. In the past, it was simply what makes and models are there and how many of each particular model do I have? But now the question becomes, what software revision numbers do I have? What ports am I utilizing? And then what operating systems are out there? And you've seen now an incredible tool that can help you get some of that information, but how does the rubber hit the road? Who's going to control what portion of the workload? And then even once you start to sort out that, who's assigned to what particular assets, it's how do you actually operationalize that tool? There's a tremendous amount of value there, but what information do you need in the CMMS, and what are you going to leave in a tool like Ordr? So with that, you need to ultimately know your tool, and you need to understand kind of the ins and outs of that. What information was coming through? Russell did a phenomenal job presenting all that information, but it's really a lot to take in. You need to essentially be able to go through there and dissect what needs to be crossed over to the CMMS and what doesn't. And the next question is, how are you going to maintain that reference? If it has the serial number, there's your primary key. You're able to pull that information into the CMMS directly from there. If you don't have that, maybe you're going off of a Mac. And there may be situations where, unfortunately, you don't have the Mac loaded in your CMMS, and you may need to put boots on the ground to actually obtain that information so you can get that linkage. And once you have that, you start pulling that information over. You're going to have your operating systems, your software revision numbers, and if you did have to put boots on the ground, then you can also be sure to get your hardware revision number as well. And then what's coming next? Do you need to start thinking about port level data, or is that going to reside within the tool like Ordr? And you're going to have to make internal policies that govern that. And with that, you can start thinking about operationalizing best practices. Obviously, you're going to be looking at security events, vulnerabilities, and threats, but another thing that is beginning to come up more and more often is when you get an ECRI alert, it's oftentimes no longer specific to a certain model, but it's also a model on a particular software version number that may have been impacted. And so in terms of being able to reduce the amount of work that you don't need to do, you can start delineating some of that. And you also want to be able to take automated action if an ECRI alert comes through or you have a cybersecurity event. You want that to be dispatched and triaged as quickly as possible, and you want a tool that can do that. And you want it to route to the right group. Is that going to go to a network access control team? Is it going to go to an HTM engineer? Is it going to go to a PACS individual? You want that to be done out the gate. And then lastly, you want integration to ensure that all of this flows seamlessly. But as you go through that, you need to start thinking through what policies do you have in place to allow that automation? Are you going to allow the cyber tool essentially to modify ACLs? Or is it something, even as far as if you see an ECRI alert, are you going to give your CMMS the capability, if it has a match, a perfect match, to be able to automatically dispatch those work orders? Or do you want somebody to review those before they come out? And that's going to determine the level of integration and how, at what capacity you can actually utilize these amazing tools. And with that, I'm going to now turn it over to Kyle, who can actually discuss the way Nuvolo can assist in operationalizing these best practices.
Thank you, gentlemen. So I'm going to do my best to follow up on two fantastic and insightful, outlooks there. I want to point out right away, Russell, I think you made some really good and insightful points that are very form-fitting for right now, especially around utilization, right? So I would call that out as one of those things that is so critical right now is the utilization of equipment, and that data tied to physical locations that are held within Nuvolo. That's a big help during times of crisis like now that we have going on with COVID. So I just wanted to call that out as something I took note of there that I thought was very good. So what I'm going to talk through here is really, finish this out with two things. What's the current state of where we are in this industry? We see a lot of different maturity curves of organizations when it comes to cybersecurity. What our proposed solution is with the help of Ordr, right? And then lastly, get into the demonstration. So this slide is really meant to depict the current state, right? Right now, most organizations we work with, generally the IT departments already have vulnerability scanning systems. They already have these network security and monitoring systems stood up, right? But what happens next is really the problem, in that when they see something or see that packet coming across the wire in some sort of passive manner that is an anomalous behavior, that's just a MAC, or it's just an IP, or it's just a serial. And finding then that specific information in your medical device inventory that generally isn't being tracked very well is finding a needle in a haystack, right? And it takes a lot of time that can be massively expedited with proper integration. And one thing I like to hit on here is modern CMMSs can help. A lot of this problem is spanning from the ingest of equipment, right? Within healthcare, we have all these different people purchasing devices, and what the data that they're collecting isn't always the same, right? So the data they're giving to the folks managing the CMMS and uploading that, they're not always capturing a MAC address or an IP against a network connected device. So what a modern CMMS can help you do is, from the ingest of that equipment, we know that not all devices are created alike, right? So we can drive dynamic policies to say, hey, when you have this network connected equipment, make sure you record this additional information before you can even submit a record, right? Or submit a new device to your inventory. So to kind of break this down further, right, we see some event taking place that creates that security event of the affected device. Gets pushed out to the SecOps console, right, that IT, the SecOps team is using. We don't know what that is. We just have an IP or a MAC. We don't know if it's a medical device, if it's someone's laptop or phone they've brought from home, let alone where is it if we can't track it back to some access point, or who supports it, right? How do we remediate that? we rely on very error-rich human processes in this example, like email and phone calls. We want to start driving that integrated system, because cybersecurity is a team sport, and everybody on the team has a slightly different lens into what's taking place. So what we're suggesting with our sort of solution, with combination of Ordr, right, is adding that additional sort of, I like to call it a translation layer, right? It's adding context to that event. So now the change in this process, as you can see, is we still have the same systems. We have the vulnerability scanning systems, the network security systems, but with the help of a passive one like Ordr, what we can do is now when we see that IP, we see that MAC, we see that serial number, we identify that to a known device in Nuvolo, right? So in the case of a security event, hopefully we have that being, tracked as an active device in our inventory, right? In the case of a discovery event, we might want to take slightly different action, and we'll talk about that in the demonstration. But this whole translation layer, it does a number of things. It automates the process to go out to your SecOps console to really give them context that this isn't a laptop, it's not a switch, it's not a server, it's an infusion pump. More specifically, it's an Alaris 8015 in a specific room, supported by a specific person, right? So they get all that information right away without the hunting, without all that extra work. Additionally, as a part of that, most organizations that we work with that are higher on what I would consider the maturity curve of the cybersecurity and clinical, they have those hybrid individuals that are IT, cyber, clinical engineers, right? So a lot of organizations have identified that person who goes out, takes the first look, maybe works with the manufacturer for an approved fix or something along those lines. So this path can drive action, right, through Nuvolo to two totally separate groups, each of which get their lens into that problem. And what we're really trying to drive with this is the connected workplace, right? Traditionally, when I got into this world, it's very common that IT, clinical, facilities, work in very, very separate silos. As network connected equipment gets more and more pervasive across the industry, we have to break those silos down. We all have to work together, not just for cybersecurity threats, but even, Russell made points about big iron. Many times, a lot of those MRIs and the big iron devices are supported by a number of different groups, right? Facilities has a stake in that, IT has a stake in that, clinical has a stake in that. We want to be able to connect those tasks and that work through one system, whether it be tasks going out, work orders, and ultimately the costs of that work rolling back up to the device for a true total cost of ownership. So with that, I am going to switch gears here into our application. So what I'm going to do now for the demonstration is really walk through, first build the framework of how this works, right? And then we'll break down the dashboard. So first and foremost, the Nuvolo OT cybersecurity offering is really broken into two pieces, the queue and the security portion. The way I like to talk to this is the queue gets all the noise, right? The queue is receiving all the events, whether it be discovery, utilization events, and security events. Today, we're going to talk about security and discovery. I don't have necessarily medical devices to, pull utilization from here. So when these are coming in, right, it's going to come in with various attributes. So here we can see we have a number of matches or events that are coming in from Ordr. These were identified. Right, so we identified them as some state and matched them against a particular known attribute of a piece of equipment that we have, right? So based on that identification, we can drive certain action. So, these variable attributes coming in, you won't always want to take the same action. So what you'll notice to kind of go along with the queue, we have an action script that is corresponding, right? So based on what's coming in, we want to take very different action. So in the case that we have found an Ordr has profiled a new discovery event, we know that this is a medical device, it's not someone's cell phone or laptop they brought from home and put on the hospital network that the medical equipment is on. we can drive action to, go through the proper onboarding procedures. So that could be, go and input the rest of the data into the asset record that, is pertaining to Nuvolo, push that back to Ordr so they know, and then go through the onboarding procedures. Everyone I worked with has incoming inspection procedures, make sure this device is safe for use. Now we're tracking it as a known device in our system, right? In the case that we do see a match or a correlation, right? MAC address, serial numbers are very high confidence matches, as I like to call them, because they're not really changing often or ever. So with that, we can be sure that we found the right device in a discovery event. So maybe we automatically want to update some device information, right? Whether it's technical information, utilization stats, things like that. In the case that we get a less confident match, like an IP or a host name, or maybe the combination of the two, maybe we want to drive different workflow, right? Maybe we want to go have a tech revalidate, go out to the device, do an inspection, and ensure that the data is correct that's coming in. Beyond that, the system is flexible in a sense that we can create different key field mappings. We can integrate with different data sources. So, Rapid7 has a place every now and then for these things. So we can drive integration between other systems as well. The next piece that I want to talk about here is the security side. So the security side is what we've taken action in. This is what's applicable to us. So right off the bat, right, things like running MDS squared assessments. We're looking for devices that, don't create an automatic log off after a point of inactivity or have unrestricted admin privileges, right? We can record our MDS squared assessments and various other assessments that we're running in the security portion here. The exploit events, we'll dig deeper into this, but this is tracking all of our known events, right? So everything that's come in that is an active or applicable event to us, what assets they've affected, and the vulnerability records themselves. Lastly, you have known vulnerabilities, right? So the known vulnerabilities are coming from FDA, ECRI, manufacturers, and it's the folks that, it's not necessarily an active exploit event, but it's an OS vulnerability or something along those lines. So that's all tracked here as well. And then of course there's a digestion mechanism to bring in, CWE imports, national vulnerability imports, all of which contain, vulnerable software, firmware, and patch levels, which are then correlated against those same, software, firmware levels that are tied to a particular device. So with that sort of groundwork, I like to lay that framework there because it really spells out how the rest of this is working. So what we're going to do now is dive into the dashboard and go through 3 key examples: an active exploit event, manufacturer vulnerabilities, and then unknown discovery events at the bottom. So first and foremost, and arguably most important, is an active exploit event, right? So right off the bat, I can see, month by month, when are our active exploits taking place? The spikes in time can give us great insight. Maybe we, had a surge in patients and had to bring in a new device that didn't go through the proper hardening procedures, right? So we had more exploits in a certain month. We can start to see those trends over time. Here, you can, like I mentioned, you can integrate with other data sources. So we can see, how many security events Ordr is creating for us based on other data sources that are potential integration points. Additionally, all these dashboards are both configurable, real-time, and actionable. So if I want to drill down and see what Ordr found, at this point in time, I can click on that piece of the pie and it will show me exactly that. So we'll use a security event here for an example. I'll just pull this top one off the top of the queue that came in from Ordr. So why I like to show this is it gets to that connected workplace example, right? Everyone has a different lens into this security event. So we are tracking this event really from cradle to grave. So Ordr saw this come in, it pushed it to a very particular queue record in Nuvolo. So this is the first time our system saw this event, right? So we track it from that point on. We can get a certain amount of information coming from Ordr, and then even a link back to, where maybe the particular record within Ordr as well. Down below, we see that there has been one affected and known device from this exploit event. So it's identified one particular device that exhibits the characteristics and is exhibiting that anomalous behavior, right? It's added the affected asset to the bottom, right? So this is where we start getting to that contextualization. It's not an IP, it's not a MAC, it's a Hospera infusion pump, more specifically a Plum 360 serialized in a very specific location. A work order went out, so maybe Ben is right, that hybrid IT security and clinical individual, and he's taken a first look and sent Kyle out to maybe go take it off the network, right? Pull it down for now until we can, figure out a path forward with either Ordr or maybe the manufacturer with some sort of approved patch or fix. Additionally, a vulnerability record was created. So this can get pushed out to the overarching security systems to track all the vulnerabilities that we have found, as an active exploit within our organization. Next, one of the most important things about this is, and that people ask when these take place is, what else do we have that this could happen to, right? So as we look at this, what's happening with these correlated asset vulnerabilities is Nuvolo is looking to see, hey, what other devices do we have that are exhibiting the same characteristics as the one that is being affected now, right? So the way we do this generally at a basic level, and it can be changed or configured, is we look at software, firmware, and revision levels, right? So we're pulling in data or those other assets, which you can then easily say, well, we only have one major issue now. We have 59 other potential, candidates that we might want to go and start being proactive with. And the last lens into this problem is your security incident team. So they have, their own system, whether it's ServiceNow SecOps or one of the various ones out there. We can then drive this event to the SecOps console, right? So they get their lens into this problem the way that they prefer to see it, right? They know it as a CI. But what's important about this is if they drill down into it, they can quickly find out that this isn't a CI, it's a Plum 360 infusion pump, right? So they get that level of context with all the information and get that same level of visibility into the device in a read-only fashion here that the clinical team does. Also, they've driven their risk scores, right? If there's any related records, and all the system sort of functions that the SecOps team is used to working from are found on their security incident record, right, which is automatically generally created. And Dustin, feel free to add any color throughout this if you'd like through here.
Will do.
As we scroll down here, the next portion of this is known vulnerabilities or manufacturer vulnerabilities, right? So right off the bat, what vulnerabilities have we had that have been correlated over the last 12 months? This is important, for one reason only, and that's because not all known vulnerabilities are applicable to us, right? Which ones have we actually correlated back to known devices in our inventory? So if we want to look at that, because many times there's a lot of noise, right? So if we look at that here, I can see what are our true vulnerabilities, and I can start looking at these graphs, and this makes a lot of sense. Based on Hospera being a pump, an infusion pump manufacturer, we can start looking at this to figure out, which manufacturers are opening us up to the most risk, and we can make buying decisions based on this, or potentially change, how we work with these manufacturers or vendors of this equipment even. Scrolling down, also, looking at this by, asset type or model, which of our devices exhibits the most vulnerabilities, right? And one of the important things about this tool is that all of these dashboards, these reports, these all come out of the box, and they, but we don't assume that they're all going to be useful, right away. Everybody has a different way they like to digest data. But all of these dashboards and reports can easily be used as templates and configured to really fit your organization like a glove and the policies and procedures that you are driving for your cybersecurity needs. Down below, I can see, where we have open medical device vulnerabilities, right? So which ones are we currently working? Which devices are they against? So on and so forth. Lastly, here we have unknown medical device discovery events. So, the way I like to talk to this report here at the bottom is when the CISO needs to go visit somebody, this is generally a good place to get some background information before that visit takes place. So what it tells me is who isn't following policies and procedures very well, right? Where are a majority of our unknown medical device events coming from? This could give great insight into really a couple of things. And if we use COVID as an example right now, a lot of, well, not a lot, most organizations are seeing major surges in patients, right? Well, that includes a surge in equipment generally to use and to administer care to those patients. A lot of times those devices aren't actually owned by the facility. They might have been lent to them, leased, rented, and many times those aren't going to be tracked in the CMMS, right? So we can start looking and using the profiling capabilities of Ordr, and we can see here's a whole bunch of device verifications coming from Ordr that have been profiled. We know exactly what profile these fell into. This isn't a doctor's laptop he brought from home. This isn't a nurse's cell phone that she put on the hospital network. These are specific medical devices that we need to add to our inventory, and we can start seeing some of the data that's being pushed in directly from Ordr, where we can then send a tech out to follow up on the rest of the onboarding procedures and data entry. Scrolling back up, seeing the numbers of where those unknown discovery events take place. So if I drill down to my Dallas, Texas campus here, I can see, what floor, what site these unknown events are coming from. I can drill down into them. If I'm the CISO and I need to go have a conversation with one of my departments at this site, it looks like my sterile central supply department is the culprit for the most case, which makes sense. They have a lot of devices coming in and out. So this helps me know, who I need to go talk to and where most of these events are specifically coming from in a sort of trend or time-based fashion. So lastly, if we look at one of these records here, we can see one of these discovery events taking place. What's going to happen here, right, is this could send a notification. We can see it's in the state of pending verification. We can add an owning department, a location. Generally, a location could even be auto-populated depending on where the wireless access point is, right? We know the device is network connected, so we can drive policy based off that. And we can see here all the technical information that was pushed in from Ordr, right? They found the make, model, the manufacturer, all of that. And then what can take place here is you can see the device verification work order went out against this device so we can properly onboard the equipment. So with that is about the last of my demonstration of what I wanted to cover. Dustin, do you have any additional points you want to make from the cyber demo here?
No, I think you did great, Kyle. Thank you.
All right, well, with that, I will switch gears back here and play from my current slide. So that's about the end of the demonstration. Within this PowerPoint, both Nuvolo and Ordr are a part of Kaiser Permanente Ventures. So we wanted to provide, a blurb of text from Daniel, one of the individuals we work with heavily at Kaiser around both companies, Nuvolo and Ordr, of course. So you'll find that in the PowerPoint. And with that, I'm going to turn it back over to Linda for Q&A.
Great, thank you so much, Carl. Yeah, we've got a few questions. The first question that's come in is, what cybersecurity solutions does Nuvolo have integrations into?
So there's really two separate areas. We have like premier partners, right, in the IoT monitoring area, which is Ordr, right, is one of those premier partners. But the framework is set up to integrate with most IoT monitoring vendors that are currently on the market, the ones that I would consider more mature, right? Hopefully that answers the question. And if someone's looking for a list of those, I'm happy to provide that after the demonstration.
Okay, yeah. Just following on that, actually another question does say, do you integrate with Cisco Identity Services Engine?
I'll let Dustin talk a little to that and possibly Russell as well. If you guys want to talk to that one, you might be a little better suited than myself.
I think Ordr, your cybersecurity tool, it's more likely that they're going to have an ICE integration because the data, the way the information is managed, that's going to be more of the IT-centric information, especially when it comes to like being able to understand what types of information you need to modify, such as access control lists. Russell, you want to tie into that?
Float, yeah. We have, at Ordr, we have rich integration with Cisco ICE Identity Services Engine. It flows in the ability to keep ICE apprised of all of the different types of assets that are behind the IP addresses that ICE learns. You know, if you're familiar with ICE, it's not very good at really identifying devices that can't authenticate. So kind of figuring out what your medical devices are, figuring out your facilities equipment. It's not very deep in terms of its understanding of exactly, you know, model number level details. And we are. So we can send all of that information over to ICE. We also automate the ability to generate any policies you want to set up. So if you want to use ICE as a vehicle to implement segmentation and controls, or you want to get down to device level controls for where systems can talk, we can automatically generate policies into ICE so that it becomes pretty straightforward to kind of leverage ICE and push out protections around specific sets of equipment that you want. We'd be happy to give a demonstration. We got lots of papers on that stuff too, if you want to go deep on it at some point.
Okay, that's great. Another question here is, does Nuvolo also tie into ServiceNow's native IT cybersecurity module to automatically create IT security tickets to security operations team?
Phenomenal question. Yes. So that's a sort of standard integration. I would call that a very well-positioned customer for a Nuvolo Ordr integration would be a customer who's also using a ServiceNow SecOps module. Being that Nuvolo is natively built on ServiceNow, we extend both that CMDB CI table to our clinical device and facilities device tables. So anything you add to Nuvolo, whether it's facilities equipment or clinical devices, it automatically adds that equipment to the CMDB as a clinical device or facilities device class. So that gives that you, and as an organization, a true CMDB of every single device that the organization owns, whether it's an IT-owned device, clinical, or facilities, right? So yes, the SecOps console is natively integrated. That is the example that I showed when I pulled up that security event, was that security incident record that was created based on that clinical event.
Okay. Another question is, can you tell if a device is unpatched and what to patch if a patch is available?
I'll leave that one to Russell, I think.
Yeah, so the Ordr technology gets down to software load levels on medical equipment, for example. And we also provide insight into understanding if you've got systems running at different patch levels. And we also provide some crowdsourcing intelligence to understand if there's later patches people have deployed in production or not. So yeah, we do have a pretty sophisticated view of being able to track kind of patch levels that you've got on different assets and understanding which ones may be older.
Yeah, and then on the other side, right, of it for Nuvolo, we then create software firmware records in the system, right? So there's actually physically a place you can store that information, so we can track the life cycle of that software firmware, the different patch levels that have been pushed out, and what devices they are effectively loaded into.
Okay, great. Another question is, how are you getting the serial number of the devices from the network layer if it's not part of the IP packet?
This is Russell from Ordr. So most of our serial number gathering is actually done through doing deep packet inspection when the devices are registering themselves to their management systems. It is true that there are certain devices that don't share that type of information. And for those, we have other vehicles to obtain it. One of them is in certain sets of equipment, we can actually talk to the device management tool itself. For example, we do that with Alaris infusion pumps, where we'll talk to the Alaris infusion pump server and obtain information about the pumps themselves, because if you're kind of familiar with the communication protocols that are used there, that's actually Alaris encrypts its data over the wire, so you can't even leverage it. And then we also have ways to try to get into network by actually looking at the device, and if you want to use this for some not very aggressive probes on a device, do an SMP biblock, we can obtain it. The last area is if it turns out there's devices that just don't even share any serial numbers over the wire whatsoever, we can absorb and import a serial number database or spreadsheet, or through an integration with another tool to get it through another vehicle too. So generally we find, at least for medical equipment, most of the stuff we can find over the wire, but in cases where there's gaps, people kind of fill that up with using some spreadsheet importation or Nuvolo integration. That's another way to do it, as we talked about earlier. So.
Okay, great. Another question here is, after post-implementation, what's the usual time frame to tweak the system and provide data cleanup?
I don't know if that question is posed to Ordr or Nuvolo. Ideally, and I'll speak to Nuvolo first, we want to take the data into our system once it's in a clean or confident state, right? The old adage of garbage in, garbage out is still true, believe it or not. No matter how complex and advanced your software systems are, you can't fix bad data, right? We can do everything in the world to control your data in a moving forward standpoint, right? Once you've moved into like a Nuvolo product, but everything behind that, unless it's in a clean, cleanly state, I always tell our customers, that should be an exercise that's done continually, not just as a fire drill before an implementation, right? Because the data can either make or break an implementation many times. It can extend timelines, it can extend budgets, depending on the state of that data. But believe it or not, the tool, within the Nuvolo and or ServiceNow, the way the interface works is it's a really good tool for cleaning data as well. So, some of our customers clean it to a certain point, and then do some additional work once it's in Nuvolo and things like that. So I guess a typical timeline is hard. The stabilization period of clients, right, with new software systems always varies, dependent on how much you tried to roll out it in a sort of a phase one deployment. If there's more specific asks from that question, I would just ask that you reach out directly to me, and I'm happy to have a conversation around that. Highly variable.
On the Ordr side, I'd say kind of our experience has been usually when an organization is absorbing our technology, there's the first eyeballs really are on the inventory side, making sure that all the inventory is discovered, the organization's comfortable with the data that's there. Ours is heavily automated in that regard, so there's not real manual work there. It's just kind of verifying that you're comfortable with what information is there. We've got all the coverage across the environment that we need to get the insight that's necessary. Often organizations will spend the first several weeks to a month to kind of make sure that that's right. And then you get into what you're discussing now in terms of how do we share our information with Nuvolo so that there's a better understanding that those systems become synchronized. In our experience, kind of modest scale organizations, hundreds of bed hospital size, that effort can take, it's on the order of weeks, not months, to kind of go through that, and it's more of a directed project, and we obviously assist with that regard as with Nuvolo in terms of making that happen. For larger scale health service organizations, which have lots and lots of locations, it takes a bit longer because there's a lot more people involved and there's a lot more systems to reconcile, but it all becomes kind of under that same kind of framework.
Yeah, and then I'll note on that too. What's really important on that too is tracking some of those correlation attributes, I'll call them, in Nuvolo, right? So we have to have something to tie what Ordr is seeing to a record in Nuvolo, right? So generally that's IP, MAC, serial number, a combination of them. So having that data in your CMMS to get the true value out of this better together solution is critical.
Okay, we've got time for one more question as we're coming up to our hour. What insights does Ordr and Nuvolo provide on maintenance or for procurement decisions?
So in terms of maintenance and like procurement decisions, one of the things that Ordr and Russell really touched on towards the end of his presentation, utilization. That's going to be huge, especially when it comes down to your mobile fleet and understanding the best way to right size your inventory. And then also in terms of appropriate scheduling for your heavy iron, that's going to be a big piece too. As far as trying to think through and kind of create proactive best practice when it comes to maintenance, you could use vulnerabilities and threats to kind of guide that, and what I guess manufacturers are using as far as like patch management, but that's going to be a little bit more complex. That information, I would say, a lot of, at least you're thinking about maintenance, is going to be governed strictly by the CMMS.
Yeah, I mean, to kind of add on to that, we actually did with one of the organizations who's using our technology now, during the POV in the first 2 weeks, we were showing some of the utilization on some of their pumps that we were observing. And, turns out that a lot of pumps were underutilized. And at the same time, that same organization had a request to buy another score of systems. And so they immediately canceled that purchase, saved about $100,000 just during the POV in 2 weeks because of the utilization data. That's the type of thing you start getting insight into, because you get very data-driven information of exactly what systems, have we discovered? Does it match your known inventory? And then of the systems that are actually connected, are they actually doing anything right now? And by being able to, show graphically and on a per device basis exactly which systems were not being used in the last week or two and not delivering care, that's just hugely insightful. And most people just don't have any insight into any data-driven decisioning, saying, if I'm going to buy some more equipment, do I really need it? And what's my utilization capacity right now? That's a huge first step. And then, as was talked about, kind of tying that into preventive maintenance controls, where if you're not using things as heavily, do you need to maintain the stuff as often? That's exactly where, Nuvolo has been spending a lot of its analytic intelligence. So.
Great. Thank you so much, guys. We've now come to the end of our hour. So thank you once again to Carl, Dustin and Russell for a great and very informative webinar. And thank you again to today's sponsor, Nuvolo. Just a reminder that the post-webinar survey and certificate process is automated, so the survey link will be included in the follow-up email, which you'll receive in about an hour's time. Once you've completed the survey, you'll be able to download your certificate immediately. If you have any questions, please contact us at webinar@mdpublishing.com. And for more information about all our upcoming webinars, please visit our website, webinarwednesday.live. So thank you once again for everybody to join us. Stay safe, and we hope to see you next time.